but as a physician, you always have to keep in mind the patient's not your client, they're your patient.
Is there any way to prevent it?
It is genetically derived. Weight, the heavier you are, the more likely you're going to have it because the folds and frictions add to it. But a lot of it is genetics. And 398 of them, 30 minutes, they're like 100% cured.
Wow.
And you know what satisfaction that is? Like, it's amazing.
Yeah, compared to neuro?
Huge.
That's satisfaction you can't get.
Yeah. Because of a guy trying to be a doctor in a time he doesn't need to be a doctor, where he could have just healed. My grandfather died literally because of this. Welcome back, man.
What it is. We're back. Bro, honestly, I feel like this week has been the longest week of my life. Do you feel that way too?
You know, it's only Tuesday, right?
I know, but the whole time change,
yeah.
It's like my clock, like I wake up like 6:30, that's like automatically. But the reality is it's 5:30. So I'm exhausted every single time I wake up. I don't know why.
Yeah. I feel like a lot of people do that, but don't you enjoy that extra hour?
Yes, and of sun and daylight.
Like most of the time when we get out of work, the sun is already down. It's kind of depressing.
It is.
Yeah, but it's extra hour of just work.
Yeah, that's a good point. That's a good point.
So you wake up and just start, what do you have 1 hour? Extra work.
Yeah, you know, I never thought about that. It is an extra hour of work.
It is.
No,
well, that's why we're tired. It makes sense. It makes sense. Well, welcome back. Today we have a fantastic guest. We are really excited to have him on. Dr. Utpal Patel, world-renowned dermatologist, famous. This guy is awesome. I mean, he does everything: skin cancer, he does biopsies, he does surgeries, he does it all. I have a lot of my patients who see him on a daily basis. They go see him, a lot of them, and they speak nothing but great things about you. So welcome to the DocTok Podcast.
Well, thank you. I appreciate you having me here and allowing me to serve your patients. And it's a joy of my life, and it's always the best part of the day. And you allow us to do it. So terrific.
You, man. Thank you. We're really excited. And my brother's in Newport Richie, so you probably don't see much of his patients, but
I'm gonna start sending you.
We hope to.
Don't worry. Yeah.
Never busy enough.
Yeah,
extra hour. I can see a few more patients now.
You know, the reputation for dermatology for a while, they were getting the idea, and we were just talking about it as just like doing things unnecessarily a lot of times.
It is true.
And they got about a bad rep for it. But I feel like with like you were talking about, is like you do things to make it easy for the patient, and I love that. And that's what makes a difference.
Well, I think that's like a global problem for all of medicine altogether. As more and more things are becoming corporate, money is always a driving force.
100%.
I think, but as a physician, you always have to keep in mind the patient's not your client, they're your patient. And then you're in the room, you're just thinking about that person. And if you do that, like, things work out pretty well. I think derm has gotten a lot of bad rep.
Yeah.
And a lot of it is either we're like interested in just cosmetics, we're interested in money.
God, cosmetics change so much in derm.
Right, absolutely. Or it's more private equity driven and lots of providers and not so much doctor driven, and not want to do medicine. Or do want to do rashes, they want to do just surgeries. So like all these factors are involved in any field. But, you try to do what's honest for you, true for you, and keep going.
Well, let me ask you a question before we get into depth of skin cancer and rashes. As a dermatologist, if you have one of my patients and their blood pressure is high, are you the type to be like, you know what, just take an extra lisinopril? Would you do something like that and treat it, or will you just focus mainly on dermatology?
No, I think you probably know. Like, I think that happens actually often. You're doing surgery.
Exactly. So especially surgery, right?
Yeah, we're doing surgery, and you're not on any blood thinners, but you're bleeding. There's no reason for you to bleed. And then you ask them, and then you're like, they're a little stressed out. Like, you ask them, has the blood pressure been high? It's like, yeah, it runs a little high, 150s. But they think it's fine, though, by the way. It's like, that's normal. It's like, okay.
That's my baseline.
That's right.
That's exactly right.
You usually tell them, like, I would write it down for a week and then go talk to your primary.
Yeah, good
like,
idea.
that's my answer. Like, usually, like, write down a diary. Coming to you primary doctor and saying, my blood pressure is high. It's a one moment in time. You're already stressed out. My primary calls me, I'm stressed out.
Yeah.
So I don't need that.
Yeah.
So diary, go talk to them and go from there. Often that comes up also with the rashes, like drug rash related.
Reactions.
That's right.
Yep.
We're always trying to work on that.
I feel like rashes is probably one of the most complicated things for us as primary.
Even for
so
dermatologists.
hard. It's
Even
like,
for
really?
dermatologists.
Is it really?
It is
Because
the
I
hardest thing.
hate rashes.
Honestly,
too.
it seems so
Us too.
simple,
Yeah,
but
us too.
it's so hard.
No,
Yeah.
incredibly hard for
It's
us
like,
too. Nobody wants
thank
it.
God.
Nobody
I
wants
thought
it.
Steroid cream,
Rashes?
Benadryl, then
Yeah.
the steroid oral. Then it's like the same method,
Right.
even though they're all different rashes.
Wait.
Like
How many times have I texted you a rash or you texted me a rash? Like, yo,
a million times.
do you have any
What
idea?
is
I'm like,
this?
I have no idea.
Because like, okay, like if it's a simple hives, I got it. If it's
Yeah.
a tinea, I got it. If it's a shingles, I got it. But outside of that,
Yeah.
it's like, what is it?
Right.
And that's why to have a dermatology friend is amazing.
It's the best. I text him all
I'm
the
gonna
time.
get-
The rashes are hard for us too. We feel the same way. The dreaded visit is like rash or a hair loss.
yeah.
Oh,
hair
for God's
loss.
sake, you can't mix
Hair
those little
loss.
things.
Yeah.
That's our hypertension
Yeah.
and diabetes is rash and hair loss.
Oh,
That's
man.
everybody. It's like, what do you want me to
Painful.
do, bro?
Painful.
Like,
Painful.
Exactly. That's
Absolutely.
crazy.
but what do you do? Like, I'll give you an example. So, like,
Yeah.
if you do have a rash, somebody comes in with a rash, they've tried steroid creams, all of them.
Right.
They've tried oral steroids. They've given injections. They've tried the antifungal. What do you do next? Like, do you biopsy it? Is that like the next?
I mean, then if you don't know, biopsy is the way. But before you do that, you got to look for subtle clues. You know,
Yeah.
what you're really looking for is like, okay, how long has it been there? What season? Is it spring? Is it fall, winter, summer? That makes a difference. Whether
Okay.
it's humid environment or if it's dry environment, those things play a role.
Can you give me like examples of like
So,
what
like-
each one would be?
Yeah,
Like-
so like for example, if you are like in Florida where it's very hot and humid, actually when it's like winter right now, people are wear more like layered clothing, but it's still humid.
Yeah.
So you get a lot of moisture on the back.
Yeah.
And that leads to actually like folliculitis or things that you think of are more like summer conditions, but in Florida you see them in winter.
Yeah,
Because
yeah.
you got to think it's humid and people are wearing occlusive clothing.
Yeah, exactly. So
And
they sweat more.
So you go like, okay, this is more likely to be folliculitis or like Grover's disease, which are related to the warm, humid climate. You see that in summer, but not as much here because people tend to wear loose clothing.
Yeah.
And then you are no clothing. You know, of course, if
Yeah.
you're a
I
man,
mean,
you just
shorts
take the
all
shirt
year
off and
round.
go, which is great for skin cancer business,
Yeah.
but not people otherwise.
Cha-ching.
But like, so you think about that. You know, if you think about like, if it's winter and you got rash on the legs, you're more likely to think eczema.
Okay.
You know, that really makes a difference. If it's summer, then you're like thinking eczema is less likely in an adult if it's summer.
Okay.
That doesn't make like atopic dermatitis, intrinsic eczema, something that's because of who they are.
Yeah, yeah,
not from
exactly.
external.
Yeah,
so
exactly.
if summer somebody comes to me and has eczema, I'm more thinking, oh, it's an external factor.
Yeah.
Okay.
And if it's winter, I'm thinking it's probably who they are, and it's their
asthmatics
propensity
possibly,
to
yeah,
make it.
exactly.
That's right.
Okay.
So those things play a role, you know. So you're looking at those things.
Nice. So, okay, let me ask you a question because I get this a lot in my office, and I'm sure you get tons of it too. Like actinic keratosis.
Yeah.
Like those brown raised lesions that look really, really ugly.
Oh, you mean seborrheic keratosis?
I'm sorry.
Yeah.
It's not actinic. It's seborrheic keratosis.
Yeah.
I apologize.
Cryotherapy all day.
Yes,
It's
exactly.
constant cryo, but patients freak out.
I don't need to see derm. I'm like, dude, you do not need to see derm for that.
But
Like,
can I be honest with you, Mo? I've had patients that I've biopsied a seborrheic keratosis.
Right.
It ended up being squamous.
It does happen. So
You know?
seborrheic keratosis
Yeah.
are very like, you know, the thing is, it's the thing that you can easily miss because you see thousands of them a day.
100%.
And that's where like you have to remember not to be too confident in yourself.
Yeah.
You
Amen.
can't be just look at the back. Oh, you got like same old thing.
Yeah.
But you got to look really, really carefully, and you're looking for the color.
Yeah.
Like, is
Yeah.
it red and scaly, or is it brown and scaly?
Yeah.
And that's what I like try to look. Or I'll push, like just give a gentle tap and see if like, hey, does it feel sore? It's people will say it's not so sore, but it's sensitive, like a piece of glass or a thorns in it.
Yeah.
Then you think maybe the seb is a squamous cell,
Yeah.
and we forget that the seb derives from the skin.
From the skin, for
so
sure.
of course, anything that can happen to the skin, melanoma, basal cell, squamous cell, rash, anything can go on the seborrheic keratosis.
Yeah.
So of course, but it's thing that patients hate, and I call them barnacles,
Yeah.
and some people call them wisdom spots, but I
Wisdom-
think barnacles are the right term.
I agree.
And nobody wants
Wisdom.
them.
They
I
have
don't
it the
want
most in
them.
Florida.
Yeah.
I swear, like doing like rotations to Chicago compared to here, I don't remember seeing it that much.
Yeah,
Here,
yeah, I don't see
This is
it.
old, man. We're just
man.
old.
Yeah,
It is
yeah. It is
It is.
older people.
Yeah. It
It's
is.
more common in older
Yeah,
folks.
yes, yes.
I mean, if
Yeah,
you can
you're
give
not
up-
going to see it in a pediatric rotation. You're not going to see it in a gyne rotation, right?
Yeah. No.
You're not going to see it in a surgery rotation unless they're really old. But this is, I mean, for us, you'll see it constantly.
That's
for
right.
sure.
That's right. And I think it's everybody hates them. They're ugly. They
It
kind
is.
of catch on things and whatever. But they're just nothing.
Yeah, yeah.
Part of life. Part of life.
Yeah, I agree.
While we're on that topic, skin tags, do you recommend cutting them, leaving them alone? Because everyone that has, especially with necklaces,
Yeah.
they always want them cut off. But
I always say like it depends on how much it matters to you.
Okay.
Like, is it
Good
worth
idea.
spending that money or going to like Burns, a steakhouse, instead of getting the skin tag removed?
Yeah.
Or that's the kind of the way to think about it. If it bothers you enough to spend the money to where you can, instead of doing something fun, then do it.
Yeah.
If not,
Yeah.
forget it.
It's more quality.
That's
quality.
right.
It's in how you want to look. If it's really affecting the quality of your life,
That's
you hate
right.
it, take it off.
Everything is
Yeah,
like that.
exactly.
does it have
So-
genetic
so-
factors? Skin tags? Genetic factors?
Yes, it is genetically
It's
derived.
genetic, okay.
Weight, the heavier you are, the more likely you're
Really?
going to have
Okay.
it because the folds and frictions add to
Yeah,
it.
for sure.
But a lot of it is genetics.
Is there any way to prevent it?
Absolutely. Well, lose weight.
Yeah.
Yeah, I agree.
Lose weight.
I agree. And you
But
look
it's
at the
very
majority of
hard.
heavier people, they got tons of them on
That's
their
right.
back. You've seen a lot of them too.
Yeah.
No, these are the questions I've been asked, and
Yeah.
I want the viewers to get a lot of that
Well, that's
because
right.
we're
Sure.
specialists.
It's
Yeah.
just- I always say it's part of life you can't control. Part of it you can't control.
Okay.
So genes you can't control. Weight, to a certain extent you can control.
Yeah.
Not always,
Yeah.
but sometimes you can. So
Yeah.
that's the key. But those things will always happen. Sometimes as you get older, you have to adopt the Buddhist philosophy. Accept the things. You
Yeah,
know what I mean?
accept it.
Accept it, let it
That's
be.
right. That's right.
I agree.
How often do people need to do like skin checks?
So I think it depends on not everyone does need to do a skin check. It
Yeah.
depends on whether you're high risk. So if you're a fair skin, fair eyes, red hair, and past 50, 60
Not
years
us.
old in
Yeah.
Florida, a lot of sun, you got to do it.
The opposite of us. So
That's
look
right.
at us.
Brown-
If you're the opposite of
That's
us,
right. Right. You got to worry. That's when you do skin checks. If you have a skin cancer, then obviously you need to do skin checks a little more frequently. But it should become part of your routine.
Yeah.
It's like every so often you just look at yourself.
Yeah.
I think the best thing to do is now we have cell phones with pictures, so accessible. If you're not sure, take a picture. Cancers change. Next month, you play like the game you play with your little kid when you're like 6 years
Yeah,
old,
kinda
3 years
like
old.
matching.
What's
See the
what's
di- what's the
different?
difference?
Yeah.
What's the
That's
difference?
right. And you do that, it works really, really well.
a good idea.
Universal skincare policy, skin check for everyone. I think that's too much. We were talking about
Yeah.
earlier, too much care, and that's unnecessary. But I think it's whether you're a risk or a high risk, low risk, things like that play a role in it.
It's calculated for
That's
sure.
right.
It's
Absolutely.
definitely calculated, and I'm sure you see. I mean, I think let's go down the list, right? Of how dangerous these cancers are, from like the least invasive, least dangerous to the most invasive. So I know melanoma's on the top for sure. Right. And then would you say underneath it would be squamous?
Squamous would be the next, the
Yep.
most common
Of course,
one.
the most common
basil's
one.
so easy.
Basil's right, kinda right
you can
after.
tell. For some reason, I look at basil from a mile away and
Yeah,
I know
yeah,
right
yeah, that's
away.
right.
I don't
They
even
should-
need to
they're really
biopsy
easy.
and I know.
That's right. That's correct.
If you don't mind me, since you are going over, so melanoma, what type of procedure do you do?
So melanoma is generally like, about 200,000 people get it a year.
Wow,
Okay.
that's a pretty big
100,000
number.
are usually caught like in situ or stage 0, which is great. Basically of 99.999%.
So it has to depend on the stage of what you
That's
do.
right.
Okay.
And so when you biopsy, you kind of have to think about it, like look and say, is it superficial, you think, or is it deep? And you want to try to get the biopsy to certain depth. So
Yeah.
if you think it's superficial, you can do a shallower biopsy. If you think it's going to be deeper, do a deeper biopsy, because the depth is what determines its prognosis
Okay.
and the
Gotcha.
treatment guidelines.
Okay.
So that's what you start with. And I think things are really, really, really getting better in that field now. So,
Good.
most melanomas, there's got thin melanomas. In office, you're awake, 10 minutes, simple excision, numb it up, cut it out, stitch it up, you're done.
Yeah.
And that's vast majority. If they're a little bit deeper and there's a concern for like whether it could have spread, you look at looking at your lymph nodes.
Okay.
But as more and more newer data comes out, that's really not
Less
favored.
likely.
And I think
Yeah.
you can get away without doing it, because the main advantage of sentinel lymph node has always been whether you can do immunotherapy or chemotherapy, do you need it or not. But the newer ways of doing it, you don't need that. So people can avoid go to the hospital, get the lymph nodes dissected, and still move on.
Yeah.
And so I think it's really advanced. So vast majority, you can do it in office, 10 minutes, you're done, and you have a 99% survival.
Why is it so much more dangerous than the rest of them?
So they grow very, very rapidly. To give you an idea, so if you wait 1 month, 30 days to 59 days after the biopsy is done and you get diagnosed with melanoma, you're 5% increased risk of dying.
Wow.
So just waiting a month.
Just waiting a month.
Yeah, if you wait 1 month after you do the biopsy, you are about 16 to 25% risk of going up one stage.
Oh my God.
It's really, really critical. So
get to it. Yeah.
No. So when you have a melanoma, like sometimes people say, "Oh, I wanna go here, I wanna go there," and I always say, "Look,
don't waste time.
you can go wherever you want.
Yeah, Moffitt,
Anything you want to go to,
Tampa,
no problem. But if you can't get it done in 3-4 weeks, then that's a problem.
Yeah, exactly.
The timeline is a big issue.
Yeah.
So like in our practice, if you get a melanoma, you get a
Get
call
it
that
out.
day, you come that day, it gets cut out that day.
Yeah.
You're done.
You're not gonna
Because I
wait.
wouldn't want to sleep with it. If I know 1
100%.
month I'm going to have 5%
Yeah.
of
No,
it
I'm
there,
good.
no,
It's like
not
a
gonna happen.
ticking bomb.
That's right.
Yeah, and you know what? To explain to a lot of our followers, like what does melanoma look like, right? It's not your typical raised, brown. It's very kind of colored, right?
Yeah,
Colored, kind of more flat, and it's not perfectly circular.
It's like
sometimes,
multicolored, like
right?
different brown, different
right.
shades
Yeah,
of brown.
green, blue. You see, right?
The easiest way I can explain it to patient, I usually just say, look at yourself and look at the pattern of moles you make. So like if you're Caucasian, you typically make light brown or like skin color, like Cindy Crawford kind of moles that are raised, But like as people who have more skin of color, they're going to make a little bit darker moles.
Yes.
And so that's the spectrum. And you want to look for an ugly duckling.
Yeah.
A mole that sort of doesn't fit what you have.
Yeah.
And then I'll tell them, if you see one, take a picture. Month later, look at it. If it's changing, that's what you worry about. But the key is people always think about the ones that are rough and raised, like
Exactly.
you said. They come to
They
all the
worry
time,
about
I'm
it.
worried about this rough and raised. It's usually seborrheic
Exactly.
keratosis. It's just an ugly
usually
spot. Right?
the raised brown, scaly. I'm not afraid of. I get
That's
scared
right.
of the flat, discolored ones that are just kind of like, ew, what is
That's
that?
right.
You know?
Exactly. You
Yeah.
want to look. I always say, try to catch it when it's flat. Then you can do something about it.
Yeah, for sure.
If it's in your skin, just in your skin, you have 99% survival 5 years. If you go to lymph node, you're down to 75%.
Wow.
Oh
go to
my
the
God.
body, 5 year, 30% is what we're talking.
People don't understand that it does spread and it does go to
very
those
rapidly.
things.
Yeah.
Yep.
And they
Very
just
rapidly.
think it's a regular, it's just another skin. It's not a squamous. It's not a basal.
Right.
There's two different things. There's people that have had squamous their whole life.
That's
Yeah.
right. Yeah.
It's nothing happens.
Yeah.
See, a lot of the cancers we still don't understand. There's somebody's always said this analogy. The melanomas tend to be all aggressive. Squamous cell, like you said, are more like, some are turtles and some run like rabbits.
Yeah.
But you don't know which one. So we all treat them. We treat
The same
everyone.
way.
But I
Yeah.
tell the patient, look, we don't know which one is slow growing, which is going to be rapidly growing. One day we'll know, and we'll be able to say, you know what, this one, you're 80 years old. It's not going to be a problem for 35 years based on this genetic profile. We don't need to worry about it.
Mm-hmm.
Or we can do a simpler treatment just to stop bleeding or pain. But this one's going to grow quickly. You got to treat it.
Yeah.
So one day we'll be able to differentiate that, and we're looking forward to that day. But melanoma is not like that.
So, yeah,
melanoma,
straight up.
Yeah,
it's
I
got it
agree.
done out. It's
Get
got
it out.
That's
Especially
right.
when it comes to the face.
Oh,
like
and-
for us, what makes it complicated is like, I want to cut it, but I'm so scared. Am I going deep enough? Is it wide enough? I don't want to scar the face. That's why a lot of times when it gets by the eyes and it gets to the face, I send them to a specialist,
Right.
to dermatologist. I don't want to scar them. Like
Yeah.
No, you know what? The reality is you always get a scar,
Yeah.
but you just want to make it a good-looking scar.
Of
You know,
course,
that's
of course.
You
It's
don't want to
contrary,
right, yeah.
remember it. You don't want to have patient every time they look in the mirror. You don't want to be reminded of that thing.
Yeah.
Where-
Yeah,
so
you don't wanna
as
get rid of it.
people are very comfortable understanding they get a scar. People say radiation is scarless. No, actually, it has a much worse scar than a surgery.
Yeah, I agree.
But it takes time for that scar to appear, so people don't think about it. You
Yeah.
only think about tomorrow. You only think about a week from
Yeah.
now. You
Yeah.
don't think about 3 years from now.
I remember a lot of some of my patients because sometimes I see that you'll probably send for radiation. You did a Mohs procedure, and you could have two different types of patients with squamous cell, both of them. One, you just removed it and didn't do anything.
Right.
The other one is like invasive radiation, chemo.
right.
It makes sense now
Right.
because it really depends
On
on
the-
how fast growing it is.
That's
you
right.
know?
Yeah.
It makes complete sense.
And there's lots of people trying to figure out the factors. Like
Yeah.
eventually it'll be all genetic driven,
For
but
sure.
right now it's more like soft factors. Like, is it down to the bone? Does it have is the tumor wrapping around the nerve?
Yeah.
Because that's an aggressive risk.
That's an aggressive.
Do you see it in the blood vessel? well, that's an aggressive. That kind of makes sense
For
to
sure.
everyone. Like you tell a patient, hey, the tumor is in the blood vessel and I see it. This, you need to be extra careful. We got to do a little bit more. They get that.
Yeah,
And there's
understood.
some of these things make the cancer a little more aggressive. But again, it's all visual. We don't know definitively, so we try and do the best we can. But it's working, you know,
Yeah.
and it's improved tremendously. I mean, tremendous. Every cancer. I mean, I'm sure you guys deal with other cancers.
that's
Yo,
People are
constantly.
so much better. Lung cancer, prostate cancer, kidney
But we're
cancer,
seeing it more like
breast
prostate cancer and
Insane.
colon cancer.
Yeah.
I've never seen so many.
Oh yeah, yeah.
It's growing like
ridiculous.
crazy though.
The,
It's
the
ridiculous.
rates keep going up because we kind of do a lot of damage to our bodies.
Yeah.
But then at least as medicine is getting
Treatment-wise,
better, we're getting
agreed.
improving.
We're
Agreed.
also doing a lot more prevention too, right?
Yes.
Like we're focused a lot on prevention, and I feel like we're catching them a lot quicker and we're treating them a lot quicker too. But then you'll have like I mean, I could count maybe 3 or 4 patients since I started practicing. You know, you had one of those patients that like I haven't seen a doctor in 20 years, and honestly, I was kind of forced to be here today, and I don't want to see anybody. Smoker, long term, I'm fine. Labs look good. Low dose CT scan. Boom. Lung cancer. You know, it's because there's a lot of people that don't want to go see doctors. They don't really
they just
care.
wait. They just wait.
They wait and they sit
It's
there.
the fear. It's
yeah,
a fear.
It's the fear. Exactly.
Well, you know, I think the way our human nature works, it happens with us too. Like the first time when you do, first step is like you don't know, unknown. Then life happens, and you want to go, but you're a little bit unsure, busy because you don't take it seriously. You wait a little bit longer, the problem becomes much bigger.
Yeah.
Now you don't go because you're embarrassed.
Yep.
So what is the doctor going to think? He's going to think I'm like some stupid or like just not a normal person.
Yeah.
Think negatively of me.
Yeah.
You know, like what's wrong with this guy? They're going to make fun of me. This is how we think.
Yep.
And so they don't go. The problem gets even bigger. And then finally somebody forces their hand, whether it's family
Yeah,
or
exactly.
friends or
Friends
somebody.
or significant other.
But that's why a good doctor makes a huge difference.
Of course.
Because like
Absolutely.
if I trust you, if I go to you and I trust you, no matter what you say, I'm gonna do it.
Right.
You
I mean,
tell
that-
me to eat crap, I'm gonna eat crap. If like whatever
That's
you
right.
recommend, I'm gonna do it. But if I don't trust you, I'm not gonna do anything you say.
Yeah.
Well, that's the big, you know, like they say, like it's the Spider-Man thing. With great power comes great responsibility. The
Yeah.
doctors, as us, we have that responsibility. You know,
Absolutely.
people who put a lot of trust in us. I
Yeah.
cut on people a couple thousand times a year on their face.
Mm-hmm.
There's a lot of faith that their face is still going to have a look pretty good.
For
They're
sure.
not going to, their nose, they're going to be able to breathe, they're going to be able to see. And so trust is always there. And the primaries play a big role, of course.
Yeah.
AJ, you always send patients to me. You know, it makes a big difference. People ask me, like, how come you don't market, you don't advertise, you don't do anything? My office's buildings don't have any, like, signs. You don't know I exist there.
Yeah.
But I'm still busy because when a patient gets referred by a primary, they come in with a trust.
Yeah.
You know,
Yes.
it makes life so much easier.
Yep.
I agree 100%.
The treatment works better. Patients are more compliant. You've got better cure rates. It's like, and there's nothing magical.
Yeah.
Agreed.
It's understanding, the patient understands that, hey, you have their interest in her, and then they're going to do the things. And I think that makes a
100%.
big difference.
It makes a
they,
huge
They
difference.
have to do their part too. This is the issue. A lot of patients don't understand that, like, in order for all of this to be facilitated, for you to be treated well, it's a process. It's a step-by-step
right.
process. You saw your primary. You follow up with the dermatology. They recommended this. Some patients don't follow up
That's
and
right.
don't continue,
Right.
and then be like, oh, well, you didn't. Well, you have to do your part.
Well, the beauty of America is, you know, you have choices,
Yeah.
but along with the choices comes consequences.
100%.
So
Fact.
everybody wants freedom to choose,
Yeah.
but they sometimes don't want to deal with the consequences
wanna
that come
deal
with
with
that.
it.
You
I
know?
feel like a lot of times they put all the pressure on us.
That's right.
And it's
That is
like,
true.
I can't make the decision for you. Like, hey, what do you want me to do? I can tell you this is good, and this is bad, and this is why. But I cannot make the decision of which
Absolutely.
route you want to go.
Yeah.
It's very,
I
very
can't
hard.
do that. And a lot of times they put the pressure on you.
Oh, they just
to
flat
make
out
that
say, what would you
decision.
do
Yeah.
if I was your mom? What would I do?
Yeah.
Yeah, oh, God, oh
And
my
that's
God,
a
we
really
get that
difficult
so
Yeah, but
much.
then you tell them,
Yeah.
and then no matter what, it'll bite you in the ass.
That's
no
right.
matter
That's
what
right.
you do.
I
Yeah.
agree. I agree. What about those patients that? Let's take two examples: mammograms and stool cards. Right? How many patients do you have that say, "I will never do a colonoscopy"? Like
a
I
lot.
get tons of those.
Lots.
AJ.
I don't want to do a colonoscopy. Okay, well your stool came back positive for blood. Oh, what are the chances? I'm like, it could be really high. It could be nothing.
Oh, right.
It could be a hemorrhoid. I don't know.
Yeah.
Maybe
You're
a
unique. You're
colonoscopy.
unique.
Yeah,
You're unique.
exactly.
It's not up to me.
Yeah, it's-
I had a lady that came to me, and she was like, I'm very healthy. I work out. I do this. I will never get cancer. And I'm like, ma'am, I'm so sorry to tell you this, but like, even the healthiest people in the world, yes, you can.
Absolutely.
And I was like, just do a stool card. So one day she grabs the stool card and she's like, aha, look, Dr. Jabal, you just want to make money off of me, right?
Yeah.
She throws it at the front desk. She's like, I'm not doing this crap. A month later, she has a little bleed. She gets worried. The whole
Rectal
toilet's
bleed.
filled with blood. She goes to the hospital, stage 4 colon cancer. And then guess what? She comes back upset How do you not pick up on this? I told you to do a colonoscopy. I told you to do a stool card. I begged you. Your hemoglobin was dropping. She's like, what kind of doctor doesn't pick up that I have cancer? I'm like, okay. That's a little excessive.
Yeah, 100%.
She came around. Obviously, this was like all fear that she has cancer, but like still, like you can't blame your doctor for that.
Well, they don't understand that these preventative tests are for a certain reason. And I'll tell you why. Even if you have blood in the stool and it came back positive for colon cancer, if you have been doing them routinely and we just caught this, it's most likely in early stages.
That's right.
So we can address it. We can treat it surgically, chemo, radiation, and then you live longer versus not doing it and not caring. Then all of a sudden you're in chemo, radiation, surgeries, up and down. They don't.
But you can't know everything. No one knows everything.
Yeah.
You know, so you go based on like what you think is likely scenarios. Okay, what's the worst case scenario? What's the least case scenario? I mean, like, yes, nobody wants to have a colonoscopy, but if you have a blood in your stool, well, it could be death.
Yeah.
Worst case.
Exactly.
You may have to go through
a small polyp
really
will take it
painful
out.
procedure for a day. You talk
You'll
about
be
it, you
bloated
laugh
for
and
2
whatever.
days, and it'll be okay. You know?
Yeah.
So you gotta.
They don't think about
That's
that.
right.
They think about the worst possible outcome. You're probably gonna be bloated for 2 days and you're completely fine.
That's right.
Relax.
That's right.
Versus if you
That's
wait
what you
and
feel
don't do
better after
anything.
colonoscopy.
Yeah, but if you don't do anything about it, can you imagine how much you're gonna have to go through to treat that
That's
type
right.
of cancer?
Yeah.
It's like,
You know?
oh, I'm so nauseous from the thing. And I'm like, oh, so you don't think you're going to get nauseous from chemo?
Yeah,
You don't
exactly.
think you're going to get nauseous from radiation?
Yeah, exactly.
Like,
Or pain.
Yeah.
Well, I can give you lots of examples of those. We'll have very large cancers, like you said, the squamous cell, and they'll need adjuvant radiation.
Yeah.
You send them for adjuvant radiation, which just means like the cure rate of is much higher if you give a little bit of radiation. It's not the main full dose radiation, even
But
if
it
the surgical
helps.
margins are clear.
For sure.
It decreases the recurrence. So you give it to them, they don't do it. I've had 2 or 3 patients I recall that have had this. They don't go because the radiation oncologists, they meet them and then say, I have to come like 16 or 20 times to the visit, and so they don't do it.
Yeah, they get mad.
And I'm like, but that's life or death.
Yeah, exactly.
Like, and then the one
That's
person
not
clearly
fair.
admitted, came back, and it's all over the scalp. It's entirely studded with cancers. And the guy literally went from doctor to doctor to doctor to doctor, everywhere. Moffitt, Tampa General, UF, all the ENTs in Spring Hill to have it removed. But it was too late. Nothing could be done. He was on chemo and immunotherapy. That was it.
That's it.
We couldn't do anything anymore.
Yeah.
The time was to go to those
They expect
20
miracles.
visits, get the radiation.
Yeah, they expect miracles.
Yeah.
Yeah. Or the ones that are like, oh, I saw the specialist and I didn't like his attitude.
That's right.
Okay, so now you're delaying
That's
this
right.
cancer until I find you another person to get the referral, to get things rolling because you don't like the attitude. That's something that I don't freaking get. I get it. For me, primarily, your primary care doctor should be you got to have a good relationship. Other than that, I don't care what the specialist, how his personality is or she. All I care about, are they good at their job?
Right.
That's it.
I mean, that matters. Personality
It
matters,
matters,
but you can overcome it. You can
Exactly.
say like, maybe the first visit doesn't go well. Like, first time I meet my patient, maybe we're not on the same length. We don't connect. But then you give it a second chance. I've actually literally walked in. I've had somebody has a bad news. This happens often where they say, I want to go to Moffitt. And I'm like, that's fine. But then I walk away, and then they come back and they say, I want to talk to you again. And then they talk to me again. And then they say, okay, actually, I thought about it and we want to reconsider. Or anything. Or sometimes patient will say something that will tick me off, and I'll say, all right, you know what, I'll be back in a couple of minutes. I go see another patient and then come back. I'm calm, and that's a second interaction. So I give the patient a chance. Sometimes the patient has to give me a second chance, because we're not the same 24/7, 365
We have bad days and good days.
Our emotions sort of fluctuate,
Of course,
especially in medicine.
We hope it fluctuates like this. But sometimes it can be like this, and we have the same psychological issues that everybody else has. We have a wife, we have kids,
Exactly.
brother, we have sister, we have all those relationships. So, but I think the key is to remember, first time if something doesn't go well, just take a 5-minute break. I usually just say, I'll be back. You think about what we talked about. I'll be back and we'll talk again. And it just gives us time to calm down.
Yeah.
And think about what they...
That's right. I think it works very well.
Yeah.
I think it works very well.
Also, I always... people in medicine always say, like, derm, the best route to go. Easy lifestyle and good money. That's a theory around everything. That's not really true, right?
No, I actually have even heard it on your podcast. You were going through the doctors and he was like, oh, derm is amazing. Easy job. You don't want to work hard. I literally was listening to that, watching like, talk to me. Just shadow me for one day. You'll see what it's like. You know,
we do that on purpose just to get the dermatologist into it.
I'm like, I'm on call 365, 24/7 for all my patients who I do surgery. They all have my cell phone.
Well, you know, listen, this is why we did it.
Yeah.
We the whole point is to get people to, react.
Yeah.
And we said, we're like, what are you going to be on call for? What's an emergency? A pimple? That triggers them so much.
Yeah, but I feel like you choose your poison also.
And listen, we've always heard like I'm a pimple popper, and
okay, so you can do fillers and Botox and pimple popping and be on TV and do whatever. You can do all that, but you choose to do melanomas and surgery.
Yeah, that's right.
That's kind of your choice.
That's right. Absolutely, absolutely.
Yeah,
I mean, the cosmetics is nice too, but some of us do like do medicine.
Derm is probably the better lifestyle out of all of them, right? Like what's better?
Look, I think there are many reasons derm is the best field.
Yeah.
Now, this is biased, but I'll give you my reasons. One, most importantly, patients get better. It's a great satisfaction.
Yeah.
They come in. If it's a rash, you treat them with something.
Gone.
They're better.
Yeah.
If they have a cancer, 99.99% of the time, within 2 hours, they're better.
Yeah.
I would say we probably have, let's say, maybe 400 melanomas a year, and 398 of them, 30 minutes, they're like 100% cured.
Wow.
And you know what satisfaction that is? Like, it's amazing.
Yeah, compared to neuro,
huge. Yeah,
that's satisfaction you can't get.
Yeah.
So that's amazing. You can make your schedule light.
Yeah.
Like, none of my other partners have to be on call. They come, they leave. I'm the only one. So it's 8 to 5. If you like cosmetics, you can do cosmetics.
Yeah.
You like medicine, you can do medicine. You can treat psoriasis, acne, kids, terrible conditions like hidradenitis suppurativa, pyoderma gangrenosum, very, very serious life-changing diseases. You can do cosmetics. You can do pathology.
Yeah.
You can do surgery. You can do plastic surgery. Anything you want. You can do veins. You can do sclerotherapy. All of it is something that
they're always
I'm
the
trained to
happiest
do.
people.
I love it.
Like when I did my rotation, like all the dermatologists, like one of them went bird watching, one of them did this. They did Monday through Thursday, 8 to 3, and they just had such a good lifestyle.
Good.
They always were the ones that pulled up in a Lamborghini and always had the best schedule. So for me,
I got my Prius. See, that's just same as Lambo.
Like,
same as Lambo. That's right.
So for me, I'm like, wait, how is this guy working 4 days, driving a Lambo, having vacations? This is what I saw as a resident. So
what about
I think it's a good balance, though. You know what the big balance is? So derm is nice because you can work 4 days a week. You can make your 350, 400, maybe even 500,000 a year. Take a day off. So you're not going to make money as the orthopedic surgeon or the interventional cardiologist,
of course,
which are maybe high 6 figures. But now you have a much better life. So these are the balance. And as we get
on call like
that's
crazy,
right.
Yeah.
And so it is a great. That's why it's wonderful to love.
We have the options.
That's right.
Any option.
Anything.
Yeah.
You can do anything you want. You can everything.
What about medical malpractice? I mean, I'm sure it's probably lower risk.
So
than,
it is.
than surgery
It is. Dermatology does have a lot lower risk. I think unless you're doing surgery and pathology, that's where the big risk is. You don't want to miss a melanoma.
Of course.
You don't want to. Then that's a big problem. But other than that, standard dermatology malpractice wise, it's a great life.
Unless you do
great
Botox
life.
and
Great
all that
life.
stuff.
Those are all great.
You don't
It's
do
wonderful.
any of that in the office?
No, I do Botox, I do fillers,
Really?
sclerotherapy, but it's not my focus. So I don't market it. If my patients ask, I say yes, I'm happy to do it, but I don't do it.
It's cash anyway. It's not insurance.
And look, it's something that again, relationships matter. When you have a relationship, they trust you, then it's easier to do. They're happy, satisfied. You're not trying to talk them into it.
Yeah.
And then you don't feel like I'm a salesman. I'm still a doctor. So I do plenty of that. But I do it for my patients who come and ask me.
Makes sense.
And I think that works.
Yeah.
And so, but I did a lot because when I was at NYU, we did lots of cosmetics.
Yeah.
And then I worked with my fellowship director. We had like 32 lasers.
Wow.
I used to be the national host of the ASLM, which is the National Laser Medicine Society. National host of their podcast.
Oh, that's really
cool.
cool.
All that is now coming to this area. I've kind of given up most of that. And I love medicine. I like people. I like seeing them. So that's what I do.
More.
Yeah.
What's your favorite part in your field?
Yeah, something you can do every day.
Yeah, what's something that you love? Do you love biopsies, punch biopsies, Mohs surgeries?
So my Mohs surgery is our favorite, but it's the second part. So the way that I think about that, Mohs surgery is my work. Yeah. I got to get the cancer out. I'm very focused. That time is when I'm very serious. Yes. I'm that's not the time I'm going to be joking around.
Yeah.
But then reconstruction is my favorite part.
Nice.
Say you got a hole in the nose, you got a hole in the eyelid, you got a hole
It's an
big
art.
lesion on the cheek. Yeah,
Yeah,
exactly.
it's
You
an
said it's art. It's totally art.
Yeah, it's perfect.
Every person is different.
Yeah.
Every person's skin moves differently.
For sure.
And then putting them back together.
That is
They
awesome.
come back a week later and they're amazing. It's
Grafts? Do you do grafts as well?
big flaps.
Wow,
Nice.
you do everything, man.
Grafts,
That's amazing.
he
full
does it all.
thickness, split thickness,
Oh.
large flaps. I mean, literally, when I tell you, I'm not kidding. Like entire cheek defects like this. Love to show videos. Entire nose.
Can you send us some
nose
videos so we
off.
can post it?
Yeah.
Yes, that'd be
Like
fun.
entire, completely through and through defect. You can
Wow.
stick like a Q-tip completely through your finger through. Fix that in office. They're awake. Hour and a half later, it's all back together.
Nice.
They don't need
That's a great
anesthesia.
feeling.
They don't need to be put to sleep.
Yep.
No hospital charge. Nothing. It's great.
That's
and
awesome.
you did it. It's your hands that did it.
I love it.
it's
Yeah, of course.
it's
That's what I'm saying.
terrific.
It's like an
I love
art.
that.
You're drawing it out.
That's the
and
best part.
And the good thing that you said earlier is that outcome that they
Yeah.
always get better, right?
That's right. That's right.
It's an amazing feeling.
Yeah,
it's an amazing
that's what
feeling.
you live for. That's what you live for.
I love it.
Yeah,
I love
it's
it.
amazing. Derm is wonderful.
I think a good something to brush off before we finish is, remember earlier you were talking about rashes?
Yeah.
I think for a lot of people, when it's like 9 o'clock at night and you develop a sudden rash, I mean, like for us, we kind of understand, but what do you recommend for the people who are at home who don't know anything about medicine and they develop a sudden rash and they don't know what the cause is? They don't know to go to the hospital. They don't know what to do.
So what's serious or not? So what do you think about?
Okay, so
Yeah.
of course, well, if you're
What if
talking
they don't have
serious,
insurance and they don't know what,
Right. So I mean, it's some easy ways.
it's not anaphylaxis, right? I'm
Right.
not talking about trouble
That's right.
breathing, severe swelling. I'm talking about a really red, itchy rash on your arm or
these
or your
petechias
torso.
they get a lot of
little
the time.
petechia.
Yeah, so, I
And
mean, if you
they're
get-
at home,
yeah.
what do they do?
So if the mild rash, I would try with just like a Benadryl if it's a nighttime because it'll make you drowsy. So take it. Or if it's daytime, take like Zyrtec, Claritin, Allegra, Zyzal, one of the antihistamines,
Mm-hmm.
and a cortisone 10. You start with that. What I would advise against is going to urgent care and getting systemic steroids because
Yeah.
then we can never figure it out.
Yeah.
You don't know what it is. It
Makes
gets
sense.
better. Now,
I have no idea.
when you come to the doctor, you go to the primary is going to say, I don't know, it's better.
Yeah.
I can't help you. You're on steroids.
Makes sense.
So, if it continues for a day or two, then go see your doctor. I think it's important people don't jump, right, immediately. First day you see a rash, if you go to the doctor and it's mild, everything looks the same.
Yeah.
It's like you can't tell it apart. They all look, babies when they're born, it's the same. Like, okay, I gotta like grow a little bit. They're gonna
Yeah,
boy or
yeah,
girl.
so
Come on, I
see the
can't tell.
difference.
Yeah.
Yes. So, it's same thing with rashes. If you're first, immediately you want to just take like a little antihistamine, put out a cortisone 10 if it's too bad, and then you let it evolve 2-3 days. And unless it's blistering or you're having blood in your urine, things like that, it's not life-threatening. And you want to just wait a couple days to see how it develops. Because even if you go to the doctor, it's hard. You could be the greatest dermatologist in the world or the dumbest. It doesn't matter.
Yeah.
Because it's too early to tell.
To really show.
Even
for
people
sure.
come with me like, do I have a cancer here in my nose? Well, if it's been there only a week, it could be
tell
just
you.
a pimple.
Yeah, exactly.
Like,
I
they
don't
all look
know.
the same.
And I'm not cutting your face to
That's
find
right.
out.
That's
Yeah,
right.
exactly.
It's impossible. You can't biopsy everything.
Yeah.
So I think the key is to like take step back and say, okay, let me see what happens over a day or two.
That's a great
because
advice.
that
Yeah.
saves you visits to urgent care,
Yep.
and then
Hospitals.
saves you antibiotics or steroids that you don't need.
Exposure.
That's
Yep.
right. Sometimes when you go to the doctor, as when I go to the doctor, I know the pressure I have. I always feel like I have to make the patient better.
Yeah.
Right.
Yeah.
And so I always have to tell myself, sometimes I don't know, and I have to tell the patient, I don't know at this point. Let's see what happens over the next 3-4 days.
They hate
and then
that.
come in. Yes,
Yeah.
they
Oh,
hate
they
it. But
hate
you
it.
have to
They
do
hate
it. Because
Like, can you imagine you go and you pay
Yeah.
$75 copay and you say, take Benadryl?
right. I get it. But that's the pressure we feel too.
I
Because
know.
it makes us look bad. But the
Yeah.
reality is, it's good for the patient. Because
Yeah.
you know what, when you go to the doctor, sometimes we end up giving, if that pressure gets us to give us antibiotics they don't need.
Antibiotics and steroids.
they
All
don't
the time.
need.
We do that
Every day.
all the
It's
time.
really not good.
We do
Yeah.
it too because the patients force us.
That's
Yeah.
right.
I'll literally get a call and they'll be like, hey, Heaven, I'm like, go ahead, start with the,
Right.
Zyrtec, start with the cortisone 10, blah, blah, blah. And they're like, they'll literally call back and say, what? He doesn't want to take care of me? He doesn't care about
Yeah.
me?
Right.
Like,
Have him
that's
call
what
me
they
back.
do. Like,
That's right.
have him
Yeah.
call me back right now.
Yeah,
And it's
that's
just
right.
like, I try to help you. That's my medical advice. That's what my knowledge is to do this. This is step one.
Right.
You want the steroid pack right away. I don't want to give you the steroid pack right away.
Yeah, no, and you call him and be like, okay, hey, John, what's up? He's like, hey, listen, last time I had this, I took a Z-Pack. Within 2 days, I was feeling great. Right. It's just like, okay, well, the symptoms lead more towards like a viral infection, right?
Yeah.
Why? I don't, or
Well, the
steroids
symptoms are similar. Like,
they're
it's
all the same.
Yeah.
But the steroids, increases your white blood cell count, increases your blood sugar, you become immunodeficient, it increases your risk of osteoporosis. It's got a list of side effects to treat something that could be fixed by tomorrow or 2 days.
Right.
You know, so
you want to save 2 days of symptoms for long-term effects.
And most of the things go away.
Yeah,
most rashes go away. Most colds go away.
People survive for thousands of years with nothing.
Hey, come on. If you give truth serum to all the doctors, we hardly ever take meds. You know what I mean? We just avoid meds because we know.
We hate it.
You know, you have one life. People always forget that. Like, you have one life. The risks, if it's a risk, is serious. Even if it's rare, but if it happens to you, it's your life.
It's your life.
There's no way to get it back.
It's
There's
gone.
no way to get it back.
That's gone.
So you have to and we live in a big society. So yes, maybe antibiotics for you doesn't do anything, but you know, if resistance builds, it's going to affect your kids. You got to think that way.
I'm trying to be a doctor too.
That's right.
My grandfather died literally because of this.
Yeah.
He felt sick. He probably had like an upper respiratory. One of his family members, his nephew, was like, "Oh, I got doxycycline."
Yeah, that was sitting there for a while.
It was an expired doxycycline. He got Steve Johnson's.
Yep.
Horrible. His skin started falling off.
Yes.
He got really, really sick, and he literally died.
Yeah,
right?
he developed renal
failure,
heart failure.
It literally killed him.
That's right.
Because of a guy trying to be a doctor in a time when he doesn't need to be a doctor, where he could have just healed.
That's right.
Virally, just treated it with rest, hydration, simple. And look, it killed him, So don't try to be a doctor.
And I think that's always tough. That's where the relationships play a role, right? Like, if you get to know the patient, they know you, it's much easier to say, you know what?
Yeah, for sure.
Absolutely. You just say, look, I always tell every one of my surgery patients has my cell phone. So I just tell them, listen, I don't want to give you antibiotics. Yes, it's like clinically, sometimes even things like some grafts, flaps, technically, I'm supposed to give antibiotics.
Yeah.
But these guidelines are made for everyone,
Yeah.
I just tell my patients, you know what? You have my cell phone. If 2 days you have it, call me.
Yeah.
We can avoid giving you antibiotics because most of my patients are older. They're on like 8 medicines already.
Exactly. So you got to look for contraindications. You got to look for something that can.
So it's not worth it. The risk just doesn't make any sense. No, most of us are very accessible to people who are nice, reasonable, and they want to work with you.
Sure.
Yeah, you work with them. It's human nature,
It makes a difference when they're nice.
That's right.
Oh, absolutely.
Yeah.
Absolutely. That's awesome.
That makes a huge difference in medicine.
Awesome,
absolutely. So.
Well, I think we've been at it for a while now.
Probably
I think
like 40 minutes.
Oh yeah, at least it's been about 45 minutes.
Honestly, I could go
We
2
do
hours.
dermatology is the most interesting people in the world too. Happy and interesting.
This is the fastest it's been. I mean, it flew. It literally flew.
That was wonderful.
But
It's because
great.
he's from Philly, you know?
Yeah. Oh, brotherly love. We're me.
Yeah, Philly people are mean.
Especially the football fans.
That's right.
Eagle fans.
You didn't see what they did to the coach after they lost to the Bucks? Why are they so mean in Philly, man? Let's end it off that. Why are they so mean?
We love it, man. We gotta be the us. We gotta have passion. That's it. It's just passion.
Passion and anger.
The Tampa games, a little bit of anger. That's okay. For a minute, you forgive. It's okay to be angry for a second.
There's nothing worse though than Packer fans. I don't care what anybody says. I cannot stand Packer fans. Green Bay Packer fans are the worst. They hate everybody. They're angry. They're pissed off.
If you're a Packer fan, let AJ know how you feel.
I'm gonna get a lot of hate right now on this, but it's okay. Bring it on. Anyway, any last words? Anything that you'd like to tell our followers before we end
this is great. I'm excited to be here. Thank you for giving me the opportunity to talk about dermatology, something I love. And it's fantastic. Hope to be back again.
Yes,
awesome.
Thank you, bro. We had a blast, man. Really appreciate you.
Thank you.
Thank you.
Thank you.
Thank you.